A new COVID variant known as the Ninja is spreading in Europe and here in the United States as well. It could be the most dangerous one that we've seen yet, appearing to be better dodging our antibodies and be more contagious. And New York City officials are now recommending that all New Yorkers wear high-quality face masks indoors and in crowds due to a rise in COVID cases. With me now is the CEO of InfuseChi and Doctor of Internal Medicine, Dr. Adalbert Pilip. Doctor, wonderful to have you on the program tonight. Can you talk to me a little bit about this new variant, the Ninja? Because my understanding is, as this was supposed to progress, the variants were supposed to become less potent. Why is it that this one seems to be stronger than what we've seen in the past?
Well, first of all, thank you for having me on the show today. I would love the opportunity to discuss this further. So yes, BA4 and 5, very prevalent. They are probably the most prevalent right now in the United States. I would say 100,000 cases a week and about 400 deaths per day. It is absolutely more transmissible. It is more immune evasive. And it does that because it seems to be avoiding the antibody landing site. What does that mean? Our immunity comes from two separate ways. We can get vaccinated, which we've done a great job in the United States, or we can get sick with COVID and get natural immunity. Those antibodies are ready to fight the COVID. However, as these variations and mutations grow, they figure out a way to survive. So they come up with ways to stay away from our immune system that is built up from either vaccine or through being sick. Even FDA at this point wants us to have BA4 and 5 integrated into our booster shots, which I think is a wonderful idea.
How long would it take to get those boosters updated to the point where they would have protection against this?
The process of updating our vaccinations probably 3 to 6 months, but I would let the experts speak more about that.
Okay, one thing fair enough. Let me just ask you about mask mandates, because some counties, some states are saying that we have to revert back to the old rules before we had vaccines in this country. And obviously, there are people that just, cannot take another wave of that again. Your thoughts on how important it is to be wearing masks?
Well, you know what? Let me extrapolate on that. I agree. We have definitely variants that are, every month we have a new variant. And there has been no evidence so far that these new variants have made people sicker or made them die more. We have immunity for a reason. Vaccinations really do work. Those are the biggest take-home message at this point. We've seen thousands of patients, my partner, Dr. Nayar, and I, and we see people with milder symptoms, less hospital admissions. They do very well.
Well, it's something that we're going to have to watch, get a little bit more data on, and see how pervasive it actually is. Doctor, great to get your insight. Thank you.